So yes, our study had two goals. Number one was to evaluate 3 different A-beta 42 40 ratio assays in plasma, as well as 2 p-tau 181 assays in plasma. The first goal was to look at how these assays perform amongst or against each other, but also we wanted it to look at the performance of the assay on more of a community-based sample cohort. So most of the studies that have been published look at clinical data sets, meaning that these are patients that already have Alzheimer's disease or some kind of mild cognitive impairment. And we wanted it to look at, in a community-based cohort, which is the Mayo Clinic study of aging, do we see similar performance that what we see in the clinical cohorts that's been published? And then also look at the performance of these different assays against each other. We looked at 3 different A-beta 42/40 assays. One assay from Quanterix, which is kind of the immunoassay that has been available on the market for the longest time, which is referred as the Simoa Quanteric assay. We also looked at a newer assay from Fujirebio Diagnostics. And then as the third assay for the 42/40 ratio, we look at a mass spec assay that was developed by Randy Bateman's group at WashU. And that assay has been published to have the highest performance when you look at the ROC curve, ROC area under the curve for these when you evaluate performance. So we look at those 3 42/40 assays, and then we look at 2 p-tau 181 plasma assay, and that was looking at the Quanteric assay versus the Fujirebio assays. And then in terms of samples, we had the samples from the Mayo Clinic study of aging, and also some samples from the Mayo Clinic Alzheimer's Disease Research Center, in order to have a good representation of both cognitive unimpaired individuals as well as individuals with MCI and AD dementia. We compared the performance of these assays against amyloid-PET. And that was also the amyloid-PET data was generated here at Mayo Clinic as well. And what we found was that when you look at the A-beta 42/40 assays, the performance is quite different between the immunoassays. We found that the Fujirebio assay had a closer performance to what has been published by the mass spec assay, so very high area under the curve. Whereas the Quanteric assay show a lower performance when looking at the area under the curve comparison. For the 2 p-tau 181 assays, we observed similar performance between the 2 assays. And the reason, why this difference in performance is important is, as we continue to do research and publish on the performance of these assays, we cannot be generalizing on performance. We really need to make sure that we include which assay we use in our studies to be able to assess the robustness of the data. At least from the data generated from our study, which is only looking at a subset of assays, from our data, the A-beta 42/40 actually performed better than the 2 p-tau 181 assays that we evaluated. However, when we look at the other literature or the other work that is being done, we know that there are other assays that perhaps are more promising than A-beta 42/40, such as the p-tau 217 assays in blood. So those seems to be ones that are kind of the leaders right now on performance when we look at their ability to detect amyloid positivity.